we had a patient that had scored very high on the PCL5, but didn't really have any discrete trauma to meet the traditional diagnosis of a PTSD diagnosis. But what the conversation allowed, as her PCL5 score lowered, the conversation sort of became about, okay, well, you didn't actually have this overt trauma per se, but the eating disorder and the diet culture and her struggle with self-esteem and body dissatisfaction, all these things that really were a part of her eating disorder had sort of a trauma equivalent for her. And though she wasn't getting trauma treatment, she was getting eating disorder treatment, her PCL5 score came down, and we were able to help her see the eating disorder symptoms, and just the belief system of the eating disorder was this experience of trauma that she was having, these rigid standards by which she was measuring herself, and or seeing herself in this very negative light due to the eating disorder mindset or paradigm, how harmful it was. So it was a change in her PCL that was really tied to the trauma of just her belief system, connected to the eating disorder. And I thought that was a really, really interesting example of how the measurement-based care really created a very interesting conversation that was very healing for the patient.